Hi, good evening all. Welcome to Tiju's Academy. This is me Abia from Tiju's Academy. I'm here with yet another live session, speaking module live session. So I welcome all you to this wonderful session of mine. We'll be having discussions regarding speaking module, and if you are having any concerns regarding your speaking module, you can comment it down and we'll be discussing about it. So, hope you all are doing well and fine. We'll wait for a few seconds for our participants to join. Hi, good evening. Welcome to this yet another wonderful live session. So, I welcome all of you to this live session. We'll wait a few seconds for our participants to join, and after that we'll start with today's session. Okay, so നമുക്ക് കുറച്ച് നേരം വെയിറ്റ് ചെയ്യാം. Let's have participants join and we'll start our live session after our participants has come. Okay, so എല്ലാവരും സുഖമായിട്ടിരിക്കുന്നെന്ന് വിചാരിക്കുന്നു. ആൻഡ് പതിവിലും വിപരീതമായിട്ട് ഐ എം ഹിയർ ടുഡേ for the live session. Usually Rajisha ma'am will be there for the live session. So now I'll be taking the live sessions, and I invite all of you for this live session. We'll wait a couple of seconds for our participants to join. Let them come, and then we'll start with today's session. So, good evening all. എല്ലാവരും സുഖമായിട്ടിരിക്കുന്നെന്ന് വിശ്വസിക്കുന്നു. So if you guys are having any concerns, you can comment it down and we'll be discussing on that. And today in particularly, we'll be discussing how to handle a first-time parent. ഒരു first-time parent വന്നു കഴിഞ്ഞാൽ, how will be handling that parent. So from this only, you can understand that today's role play is based on a bystander role play. That is, a parent is coming. So we'll see how we'll handle the parent, and within a couple of seconds I'll start today's session. Until then, let them join. Okay. Okay dears, so let's start today's session. Today's session is basically we'll be discussing on how we can handle a first time parent, and for that I've taken a role play which is very familiar to, I think, most of the students. I think we have discussed this role play earlier, so I'll be discussing about it today. Okay, so this is our role play card, where the setting is of a baby health clinic. Your patient is the mother of a 7-week-old baby boy. The baby has been breastfeeding well, but has been frequently vomiting small amounts of milk and crying after feeds. The mother is worried that the baby has an illness and is very anxious to get advice and treatment for her son. So this is our task. Our first task is that ask the patient about her concern for her baby. So we need to ask the patient about the concerns for her baby. Actually, this is not the patient. Our patient is the baby, and we are talking to the mother. Ask the parent about the baby's feeding patterns and problem. Explain your diagnosis of reflux, that is gastro-oesophageal reflux. Then briefly describe the causes of reflux: undeveloped muscle valve where food pipe joins the stomach. Second thing, we need to tell them that can occur when the baby's stomach is full of milk and as it comes back up food pipe causing discomfort. So the next task is describe the treatment for reflux. And the first one, what we need to say is feed the baby in an upright position. We need to Hold the baby in an upright position for 30 minutes after feeds, and try to give them smaller, more frequent feeds. And we add a thickener to express breast milk for 2 weeks. And the last bulletin point or the last task is reassure the mother that baby is not sick and will improve with the right treatment. Okay, these all are the tasks that we need to ask about their concern. We need to assess the baby, as well as we need to tell the parent that the diagnosis is kind of this gastro-oesophageal reflux, and we need to describe about the condition, and we need to describe about the treatment options, and also we need to reassure the mother. These all are the tasks. So based on this, I would like to ask whether it is a known case or unknown case. Is it a known case or unknown case? Could you please comment? Can you please comment whether it is a known case or an unknown case? Comment ചെയ്യാൻ പറ്റുമോ? Whether it is a known case or an unknown case. By seeing this scenario as well as the task, is it the known case or an unknown case? Yes, Santosh, you are right. It is an unknown case. Yeah, this is an unknown case. So basically, in this role play, this is an unknown case. So we need to start it all from the beginning. എങ്ങനെ നമ്മൾ start ചെയ്യും? How we will start our role play? First, we need to greet the patient, and after greet the parent, and after that, we need to do what? Make them comfortable, like good morning, please be seated, or please have your seat, or make yourself comfortable, have your seat. Angane we can say whatever the thing is, we need to make the patient comfortable. And next, what we need to do is we need to introduce ourselves. Okay, you can introduce yourself by saying, I am so and so, alangil my name is so and so, one of the registered nurses working in this baby health clinic, alangil I am the registered nurse working in this baby health clinic, alangil I am the duty nurse here in this baby health clinic, I am one of the duty nurse here in this baby health clinic. You can say, you can introduce yourself as of your wish. എന്തായാലും കറക്റ്റ് ആയിട്ട് ഇൻട്രൊഡക്ഷൻ പോകണമെന്ന് മാത്രം. So we need to introduce ourselves, and after that we need to ask for why they have been here, purpose for the visit. We need to ask the purpose for the visit. So we'll be asking എന്താണ് what's the reason behind your visit? May I know the reason behind your visit? How can I help you today? Can you please tell me about the reason for your visit? Angane pala reethiyil we need to ask the purpose. So when we ask the purpose, this mother will be like, my baby is having some illness and I'm really worried about my child ennu parayana. Appo since we know that this is a mother of 7-week-old baby boy, we need to ask whether it is the we need to ask the name of the patient. Okay, നമ്മൾ എന്ത് ചെയ്യുന്നു? പേഷ്യൻറ്റിൻ്റെ പേര് ചോദിക്കുകയാണ്. I'm so sorry to hear that. Please don't worry, I'm here to help you. So before proceeding further, may I know your child's name and age? അപ്പം കുഞ്ഞിൻ്റെ their baby's name and age should be asked. So they will be like, we will call our baby as Aiden. Okay, Aiden എന്നാണ് നമ്മളുടെ ബേബീൻ്റെ പേര്. And we'll be the baby, she is saying that my child's name is Aiden and he is 7-week-old എന്ന് പറഞ്ഞു. ഓക്കെ, അപ്പം ഈ ബേബി എന്താണ് 7-week-old ആയതുകൊണ്ട് ദിസ് ഇസ് എ ഫസ്റ്റ് ടൈം മദർ. ഇവരുടെ റീസെൻറ്റ് ബേബിയാണ് എന്ന് നമുക്ക് മനസ്സിലായി. അതായത് 1.5 മന്തേ ആയിട്ടുള്ളൂ ദിസ് ബേബി ഹാസ് ബീൻ ബോൺ ആയിട്ട് ഇച്ചിരി നാളെ ആയിട്ടുള്ളൂ, 1.5 മന്തേ ആയിട്ടുള്ളൂ. So we need to ask whether it is your first child or not. ഈ കുട്ടി നിങ്ങളുടെ ഫസ്റ്റ് ചൈൽഡ് ആണോ അല്ലയോ എന്ന് ആസ്ക് ചെയ്യുക. അപ്പോൾ they will be like, yes nurse, this is my first child എന്ന് പറയും. അപ്പോൾ നമുക്ക് എന്ത് പറയാൻ പറ്റും? We'll be able to say, we need to congratulate the patient, because whenever a new child is born, that we need to congratulate them for that. എപ്പോഴും എല്ലാ ബേബി കേസസിൽ, അതായത് ഈ ന്യൂ ബോൺ ബേബി കേസസിൽ നമ്മൾ പേരൻസിനെ ഒന്ന് കൺഗ്രാജുലേറ്റ് ചെയ്യുന്നത് വളരെ നല്ലതായിരിക്കും. ദേ വിൽ ബി ഹാപ്പി അബൌട്ട് ഇറ്റ്. Okay, so congratulations on your baby, for your baby, അല്ലെങ്കിൽ congratulations for your new for your baby എന്ന് പറയാൻ പറ്റും. So and after that നമുക്ക് എന്താണ് ടാസ്കിലോട്ട് ചോദിക്കാം, എന്താണ് എക്സാക്ട്ലി അവളെ ബോദർ ചെയ്യുന്നതെന്ന് അല്ലേ. ആസ്ക് ദ പേഷ്യൻ്റ് അബൌട്ട് ഹർ കൺസേൺസ് ഫോർ ഹർ ബേബി. ബേബിനെ പറ്റിയുള്ള കൺസേൺ എന്താണ് എന്ന് നമുക്ക് ചോദിക്കാൻ പറ്റും. സോ ഇൻ ദിസ് ടാസ്ക് ഹൗ വിൽ ആസ്ക്, we have already asked about the concern. She told us that the baby is having some illness and she is really worried about it or concerned about it. So we need to know what exactly is bothering her. So how we'll ask the question? Can you please comment? നമ്മൾ എങ്ങനെയായിരിക്കും ഇത് ചോദിക്കുന്നത്? എങ്ങനെയായിരിക്കും ഇത് ചോദിക്കുന്നത്? How we will be asking the first task? Can you please comment? Okay, we will be asking the patient, or we will be asking the mother that what exactly is bothering you. Could you please tell me what exactly is bothering you? Or yes Santosh, you are right, may I know what's bothering you? What exactly is bothering you? Okay, എന്താണ് എക്സാക്ട്ലി നിങ്ങളെ ബോദർ ചെയ്യുന്നത്? Okay, so we will be asking the mother, അല്ലെങ്കിൽ we can ask like, may I know what is concerning you എന്ന് ചോദിക്കാം. We can ask like that. And also we can ask by we can ask the patient that could you please ventilate what is concerning you. We can ask either of the way, ഏതെങ്കിലും ഒരു വഴിയിൽ we can ask. So we'll be asking what's bothering you, and the mother is saying that, ഇവിടെ മദർ പറയുന്നുണ്ട് that breastfeed ചെയ്യുന്ന സമയത്ത് frequent amounts of milk എന്ത് ചെയ്യുന്നുണ്ട്, ബേബി വൊമിറ്റ് ചെയ്യുന്നുണ്ട്, and along with that baby tends to cry a lot. പിന്നെന്താണ്, baby is really sick എന്നൊക്കെ പറയാം, and I think the baby is in pain എന്നും കൂടെ baby, the mother is saying that she is saying all the concerns. The baby is crying after even a small feed, and also the baby is frequently vomiting, and she is complaining about all the complaints that the baby is having, and she is worried that the baby is in pain and he has developed some kind of illness. So here we need to reassure the mother, because this is a new mother and she won't be knowing much about how to take care of the baby and all. So we need to reassure the mother by saying, please don't worry, I am here to help you. You are in our safe hands. You are in our you are at the right place and you are in my safe hands. So please don't worry. I will give you necessary advices how to take care of your baby and how to manage your baby's symptoms. Okay, so we can ask some questions based on that, and we'll be asking we'll be going to our next task, ask the patient about baby's feeding patterns and problems. So I would like to ask you some questions to get a clarification regarding your baby's condition. So shall I proceed with that? So the patient will be saying, of course nurse, yes nurse, definitely nurse. They'll be saying yes, okay. So we can ask them by, could you please tell me about your baby's feeding pattern? so the mother will be like, I'll be feeding, I am feeding my baby every second hourly and every fourth hourly and on demand. So she is like, ella fourth hourly breastfeed ചെയ്യുന്നുണ്ട്, and when the baby demands, then also she will be എന്താണ് she'll be giving the feeds. So now we can do a quick assessment to the baby, because whenever the babies are not all right, we can do a quick assessment. So on that basis, we'll be saying to the mother that I would like to do a quick assessment on your baby. So is that okay with you? So mother is like, okay, nurse and varnanda, we'll be examining the baby, and then we need to say that എന്താണ് ബേബിക്ക് എന്താണ് ശരിക്കുള്ള റിയൽ പ്രോബ്ലം എന്താണെന്ന് നമ്മളവിടെ പറഞ്ഞു കൊടുക്കുക. ഓക്കെ, സോ baby's problem is I would like to explain you regarding the baby's problem, that is the baby is diagnosed with reflex. I'm so sorry to say that the baby is diagnosed with reflex. That means in medical terms we call it as gastro-oesophageal reflex. Gastro-oesophageal reflex എന്നാണ് ബേബീൻ്റെ ഡയഗ്നോസിസിൻ്റെ പേര് എന്ന് പറയാം. So the mother will be really concerned by hearing that name. Oh no, is it a dangerous condition, nurse? Will my child be all right? They'll be asking so much of questions regarding their baby's condition, and what we can say is, please don't worry. By hearing this name, please don't worry. I will explain you in detail regarding the condition. So there are many reasons for, so directly we'll be going to the third task. There are many reasons for the reflex for the condition. First of all, the reason might be of an undeveloped muscle or the valve where the food pipe joins the stomach, and because of that, and when the baby's stomach is full of milk, the acid comes back up through the food pipe, and that is causing discomfort to the baby. Am I making myself clear to you? Is that clear to you? And ചോദിക്കാൻ പറ്റും. So after that, we'll be asking in the I would like to, is there anything else concerning you more? Do you have any further concerns? അപ്പോൾ അവിടെ നമുക്ക് എന്ത് പറയാൻ പറ്റും? പേഷ്യൻ്റ് ചോദിക്കുകയാണ്, is there any treatment options available to treat my child എന്ന് ചോദിക്കുക. അപ്പം അവർക്ക് നമുക്ക് പറയാൻ പറ്റുന്ന the best way we can treat our baby, we can treat your baby by keeping the baby in an upright position and hold the baby in an upright position for 30 minutes after feeds, and it is necessary that you need to try to give small and more frequent feeds. In addition to that, it is necessary to add a thickener to expressed breast milk for at least 2 weeks. Am I clear to you? Are you clear with my words? Are you following my words? Is that clear to you? There are many words or many reassurances that we can, or many follow-up questions that we can ask. Okay. സോ ഇവിടെ ആണെങ്കിൽ നമുക്ക് ഒന്നെങ്കിൽ ഇങ്ങനെ കണ്ടിന്യൂസ് ആയിട്ട് പറയാം, അല്ല എങ്കിൽ വെൻ ദ മദർ ഈസ് ആസ്കിങ് ഫോർ ദ ടിപ്സ് ദ ട്രീറ്റ്മെൻറ്റ് ഓപ്ഷൻസ് നമുക്ക് പറയാം. ദർ ആർ മെനി ട്രീറ്റ്മെൻറ്റ് ഓപ്ഷൻസ് അവൈലബിൾ ഫോർ ദ കണ്ടീഷൻ. ഐ വുഡ് ലൈക്ക് ടു എക്സ്പ്ലെയിൻ യു അബൌട്ട് സം എന്നിട്ട് പറഞ്ഞിട്ട്, ഫസ്റ്റ്ലി ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ഫോർ യു ടു ബൈ യൂസിങ് ദ സൈൻ പോസ്റ്റ് ലാംഗ്വേജസ് വി ക്യാൻ എക്സ്പ്ലെയിൻ ദിസ്. Okay, firstly, it is important for you to feed the baby in an upright position, and after feeding the baby, it is important that you hold the baby for 30 minutes in an upright position. Then thirdly, it is important that you try to give small or frequent feeds to the baby. In addition, finally, it is important for you to add a thickener to express breast milk for 2 weeks. 2 weeks take express breast milk baby ku provide cheya, and adanathu thickener koodi add thickener to this breast milk and give to the baby. We can say like that. Okay. So am I clear to you? Are you following my words? Is that clear to you? ഇങ്ങനത്തെ രീതിയിൽ what all are the things there are many other follow-up questions that we do have. അത് ഏത് വേണേലും നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റും, we can ask. So after that lastly we need to reassure the mother. So am I making myself clear to you? Is that clear to you? By following all these instructions your baby will be all right, അല്ലെങ്കിൽ your baby symptoms will get subsided. ഇത് നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റും, മദറിൻ്റെ അടുത്ത് പറയാൻ പറ്റും. So during this time അല്ലെങ്കിൽ by this time the mother will be like എന്താണ്, എൻ്റെ കുട്ടിക്ക് വേറെ എന്തോ അസുഖമാണ്, ഐ നീഡ് ടു ടേക്ക് കെയർ ഓഫ് മൈ മദർ, മൈ കുട്ടി ബേബി, ആൻഡ് nurse, please look thoroughly to my child. My child is suffering from some of the other condition. I'm really concerned about my child. The mother will be really concerned about the baby. She won't accept that the problem is with the breastfeeding and all. So what we can do this, I can totally understand your concern. Being a mother, you are really concerned about your child, and your sound shows your love towards your child. I can reassure you that the baby is not sick, and by following all the instructions which I have instructed to you right now, your child's condition will get improved, and with the right treatment and appropriate management your child's condition will be all right. Your child will be all right എന്നുള്ള രീതിയിൽ നമുക്ക് പറയാൻ പറ്റും. ക്ലിയർ അല്ലേ? So after that what you can do is എന്താണ്, am I making myself clear to you? Are you getting my points? Is that clear to you? Whatever the thing that is there we can say. Okay, so then now it's time to conclude the role play. How we'll conclude the role play? Once again, since this is a shortcut, there isn't much to tell about. We can discuss, or we can summarize what we have said. So how we can summarize this? I would like to summarize what we have discussed. So basically your child is diagnosed with reflux, that is esophageal reflux, and there are many reasons for this condition. Undeveloped muscles where the food pipes joins the stomach, and when the baby's stomach is full of milk, the acid will be coming back up through the food pipe. That is causing discomfort to the baby. And there are many treatment options available, like there are many things, there are many remedies that we can follow to reduce the symptoms of the baby, to control the baby's condition. First of all, it is important to keep the baby or feed the baby in upright position. Hold the baby in upright for 30 minutes after the feeds. Then try to give small and frequent feeds. That would be really helpful, and it will help to digest easily. Then finally, I would like to tell you that add a thickener to the express breast milk for at least 2 weeks എന്ന് പറയാൻ പറ്റും. So is that clear to you? Am I making myself clear to you? എന്നൊക്കെ നമുക്ക് ചോദിക്കാൻ പറ്റും. And lastly, it is you are not supposed to ask any questions. Please don't ask questions at the end. ഏറ്റവും ലാസ്റ്റിൽ ക്വസ്റ്റ്യൻ ചോദിക്കില്ല, because when the interlocutor is having any concerns, or when they ask any concerns, we need to address that consent, and we need to conclude after that. അപ്പം ഇതെല്ലാം വരുമ്പോഴത്തേക്ക് ഇറ്റ് മൈറ്റ് ഗെറ്റ് എന്താണ് ടൈം, ചിലപ്പം ടൈം വിൽ ഗെറ്റ് സ്റ്റോപ്ഡ്, അല്ലെങ്കിൽ 5 minutes beyond ആവാൻ സാധ്യതയുണ്ട്. So in order to avoid that, always make sure you don't ask questions at the end. Okay, so instead what you can do is, I hope I have clarified all your concerns. How do you feel about my advice? We can ask like that, and we can conclude by saying, I hope I have clarified all your concerns. If you're having any concerns, you can approach us, contact me, call me, and I'll be here to help you. I am happy to help you. I'm glad to help you എന്നുള്ള രീതിയിലൊക്കെ നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റും, പറയാൻ പറ്റും. So after that എന്താണ്, thank you Zara for your patient listening. I hope I have clarified all your concerns എന്നൊക്കെ പറഞ്ഞ് എന്ത് ചെയ്യുക, എൻഡ് ചെയ്യാണ്. താങ്ക് യു പറഞ്ഞ് എൻഡ് ചെയ്യാണ്. Is this clear to everyone? First of all, the first time parents will be really concerned about their child. So whenever we are giving explanation regarding the any condition or any new things or new terms or medical terms, these medical terms are a bit confusing and a bit frightening to the first time mothers and fathers. So always make sure എന്താണ് നിങ്ങൾ പേഷ്യൻറ്റിൻ്റെ അടുത്ത് കാര്യങ്ങളെല്ലാം ക്ലിയർ ആയിട്ട് യു ആർ എക്സ്പ്ലെയിനിങ് എവറിത്തിങ് ക്ലിയർലി ടു ദ പേഷ്യൻറ്റ്. ക്ലിയർ അല്ലേ? സോ ഫസ്റ്റ് ഓഫ് ഓൾ നമ്മൾ എന്ത് ചെയ്യുകയാണ്, ഗ്രീറ്റ് ചെയ്യുന്നു, മേക്കിംഗ് ദം കംഫർട്ടബിൾ, ആൻഡ് വി ആർ ഇൻട്രൊഡ്യൂസിങ് അവർ സെൽസ് ആൻഡ് വി ആർ ആസ്കിങ് ഫോർ ദ റീസൺ ഫോർ ദ വിസിറ്റ്, ആൻഡ് ദെൻ വിൽ ബി will be comforting the patient's mother അല്ലെങ്കിൽ the baby's mother, and we'll be asking we'll be giving her reassurances and all. Then we'll be asking the name of the patient as well as the name of the parent. When we ask the name of the patient, please make sure that you are asking the name and age of the patient, because they are our most priority. We need to ask the name and age of the patient for our documentation purpose. And after that, what you need to do is, we need to address the concern, we need to ask the question, we need to assess the baby, and then we need to describe the condition and what's the reason behind the condition, what are the treatments that we can do for the condition, and the other things like advices that we can give to the patient or the mother. Then we can reassure the mother by saying all the good things about the baby. So that's how we can do this role play. Is that clear to everyone? Clear aano ellavarkum? Is this role play clear to everyone? I hope this role play was clear to everyone. I think everyone understood how we can take care of the first time mother, or how we can handle a first time mother. Means they are really, how we can handle a confused mother, confused first time mother. I think everyone was clear with the topic, role play. So I hope I have clarified all your concerns, and guys, if you're having any concerns, you can comment it down. We'll be discussing you regarding that. So what you can do is, you can comment below the video, or you can comment below Tiju's, you can comment it anywhere below the video. So we'll be discussing on that, and we'll be clarifying all your concerns. So we'll meet next week. Until then, this is me, Abhiya, from Tiju's Academy. Thank you for your participation. Thank you all so much.